Okay, hi everyone. This is Valentina Miller, and here's my population level health education intervention. Introductions. So, here in heart disease is not only a number one cause of death in city heights, but it's also the number one cause of death in the United States. Based on the Windshield Assessment and Health and Human Services Agency statistics, as well as the interviews of stakeholders such as Jackie Kersey Hendricks, a director of HHSA branch in City Heights, and the residents of the community, there are a few reasons that contribute to the issues. Among them is poor nutrition high in fats, sodium, and increased consumption of processed foods and fast foods, which leads to obesity. Those who have been diagnosed with heart disease for various reasons do not comply with follow-up care at home, such as medications and diet adherence. And this, of course, leads to heart disease. So people don't modify their lifestyle and don't engage in physical activities. Some residents simply have poor health literacy and don't know how important it is to follow a healthy lifestyle to prevent cardiovascular and other diseases. And lastly, cardiovascular disease is so prevalent because of poverty. Not all residents have access to health insurance or health care. So rent, food, and other things become a priority. Not everyone has a health insurance, which leads to delay in care, and mostly all the care happens in the emergency room. Okay, now background and significance. Cardiovascular disease remains the number one killer in the United States, taking lives of nearly 600,000 individuals, which accounts for 23.5% of all deaths. Health and Human Services Agency reports that leading cause of death in San Diego Central regions, which City Heights is a part of, are diseases of the heart. Heart disease killed 657 individuals, which is 24.3% of all deaths in this area. For that reason, the ultimate goal is to educate the population of City Heights on heart disease, its management, and modification of its risk factors. Now, Healthy People 2020. So the goal in terms of heart disease and stroke management is to improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attack and stroke, early identification and treatment of heart attack and stroke, prevention of repeat cardiovascular events, and reduction in deaths from cardiovascular disease. Goal in terms of nutrition is to promote health and reduce chronic disease risk through the consumption of healthy full diets and achievement and maintenance of healthy body weights. So Americans with a healthy full diet consume a variety of nutrient-dense foods within and across the food groups, especially whole grains, fruits, vegetables, low-fat and fat-free milk and milk products, and lean meats and other protein sources. Limit intake of the saturated and trans fats, cholesterol, added sugar, salt, and alcohol, and limit caloric intake to meet caloric needs. Now, in terms of educational and community-based programs that play a huge role, the goal is to increase the quality, availability, and effectiveness of educational and community-based programs designed to prevent disease and injury, improve health, and enhance quality of life. So that can be done by preventing disease and injury, improve health, and enhance quality of life. Now, needs assessment. How do we know that the heart disease is prevalent? So through my Windshield survey, I interviewed a few residents who were actually talking about the history of heart disease in their family, and the importance, based on what they said, I realized that there is an importance in educating on healthy nutrition. Also, I interviewed Jackie Kersey Hendricks. She is a Health and Human Services Agency Director in Central Region. So she told me that there's a lot of individuals with the needs in regards to cardiovascular health. Also, I interviewed Shannon Stouts. She is an Associate Clinic Director of Diamond Neighborhood Family Health Center in the area. And I also reviewed Health and Human Services mortality data and windshield survey. Now, theoretical framework and needs assessment. Proceed model or theoretical framework was used for my population intervention education project. So I first started by defining the ultimate outcome. Based on my assessment, the ultimate goal is to educate the population of City Heights on heart disease, its management, and modification of its risk factors. Secondly, I identified the issue. The issue is a knowledge deficit, poverty, access to healthy foods. Then I examined the factors that influence behavior, lifestyle, and responses to environment. Those are culture, language, background, ethnicity, memory problems. Then identification of best practices and other sources of guidance for intervention design, as well as issues with policies and regulations that may influence the interventions. And those are menu in the cafeteria, in the senior center, and because they can't be changed. And also I thought that there might be poor attendance of the meeting, which wasn't the case. Next, the proceed phase, the implementation phase, and evaluation phase. So during the education session, I was able to educate the residents on of the senior center about heart disease, risk factors, signs and symptoms of heart attack, and importance of medications and diet. So in terms of process evaluation, I was actually able to educate them. Impact evaluation, is intervention having the desired impact? Yes, I was actually able to answer a lot of questions asked by the residents. And outcome evaluation, did I provide the knowledge? Yes, I did. Now, issues that I came across with was the availability of resources, that is money, place to cook and store food, and also desire to cook. Now, vision and memory problems, patients or residents state that they forget what they need to do if they don't have a constant reminders. Also, desire and motivation and self-esteem. A lot of people think that they can't perform the tasks such as cooking or managing their health. Now, also musculoskeletal conditions and inability to perform physical activities. So cardiovascular health actually requires a certain amount of activities to maintain the healthy weight and to increase the cardiac output. So a lot of elderly people, the residents of senior center, have arthritis and things like that. And also a lot of them don't trust medical providers, and they just think that everybody is after them. Now, intervention. This education project meets a few objectives of the Healthy People 2020 initiative in terms of heart disease prevention and healthy nutrition. Using non-traditional settings can help encourage informal information sharing within communities through peer social interactions. That's exactly what happened during my interventions. And reaching out to people in different settings also allows for greater tailoring of health information and education. And for a community to improve its health, and its members must often change aspects of the physical, social, and organizational environments in order to eliminate or reduce factors that contribute to health problems, or to introduce new elements that promote better health. And lastly, budget. I believe that residents of this center would benefit from continuous reinforcement of healthy lifestyles, such as healthy eating, smoking cessation, exercise, and medication management. For that reason, should occur at least every 2 to 3 months. Now, once the knowledge gap is filled and residents have clear plan and instructions on how to manage and prevent heart disease, it's free. But before that, for constant reinforcement, an RN should provide educational sessions and empower the residents every 2 to 3 months for 1 hour at a time. That would be roughly about $80 per visit, but I'm being generous. And here is the list of references that I used. Thank you for your attention.